So what are you seeing in your practice right now after these abortion restrictions in Georgia?
There are some women who come in, they might be a little bit past 6 weeks, and they aren't even fully aware that this new law has gone into effect. And so then they are left trying to search and figure out what their next step is going to be if they choose not to continue the pregnancy.
In this post-Roe era, do you have any fear conducting things like a DNC or miscarriage care for women here in Georgia?
Right now, for me, in the state of Georgia and the hospitals where I practice, I'm very comfortable if someone comes in having a miscarriage, if they're bleeding heavily, if their blood pressure is not stable, if they have signs of being medically unstable, I'm very comfortable administering the care that they need. You know, one of the challenges with these laws is that there are many colleagues, whether it's in Georgia, Texas, Louisiana, where there are still a lot of questions, and where there are some colleagues that I talk to in other states where they don't yet have a comfort level because they're concerned about some of the legal ramifications for them as providers.
And what impact is this having on Black women here in Georgia?
It's one of the things that a lot of studies show women have in common in terms of challenges to access or late diagnoses. Certainly there's provider bias, but there's also some other systemic racism factors that are impacting it. And so whether you're talking about disproportionate access to educational opportunities, employment opportunities, things that could allow someone to more easily access appropriate types of health insurance coverage, and that includes Medicaid, those things disproportionately negatively affect Black and brown women and other birthing people. Some of the things that we can do to resolve that, certainly Medicaid expansion in the states where they haven't done it yet would allow more women to be able to access care earlier if they choose to. And one of the things that we're having success with is more extended postpartum coverage. So traditionally, postpartum care had been defined as up to 6 weeks. And as we know, maternal mortality can include deaths that happen up to a year after being pregnant. And so efforts that are successful to expand that postpartum coverage to up to a full year will also, I think, have a huge positive impact on women's access.